Stephen Pierce, the Executive Director of the Housing Finance Agency, will open the presentation, followed, I believe, by Alison Carnduff, the Development Officer. Mr. Pierce.
Good morning, and thank you. Elder Choice is a program to provide housing with services for frail elders at risk of institutionalization. It's about a new place to live and a new way to live. It is primarily administered by the Massachusetts Housing Finance Agency, a state-sponsored $4 billion affordable housing bank with 350 employees. While I have been the executive director of this independent authority for only the last 6 months, my career previously in Massachusetts state government has included both elective and appointive office over 16 years. From that perspective, I want to focus on the innovative governmental processes that created Elder Choice, while Alison Carnduff will discuss the innovative product that came out of it. Public lending programs historically have been driven by available federal or state subsidy and the needs of bureaucratic oversight. Elder Choice, however, is entrepreneurial and is based on consumer preference, our consumers being frail elders and their families. Our agency began providing financing for an affordable model within this emerging industry when few other lenders were willing to take the risk, and did so without the creation of new forms of subsidy or appropriation. Elder Choice reflects a new consumer-oriented attitude at the Massachusetts Housing Finance Agency. Instead of saying, "No, we can't," staff said, "How can we?" This resulted in a responsive and flexible lending program that doesn't insist on cookie-cutter models and can be tailored to fit many different situations. The intra-agency cooperation among specialists from different divisions, such as Allison, was itself a positive gain, teaching us what can flow from horizontal collaboration as opposed to vertical direction. This new special working group was able to streamline processing, facilitate problem solving, and provide ongoing technical assistance to developers to achieve the best possible product at the lowest possible cost, and gave us lessons for improving the delivery of our other housing programs. Perhaps most importantly, through Elder Choice, the Massachusetts Housing Finance Agency has been able to achieve significant interagency cooperation as well by breaking down barriers which exist because of turf issues among our elder affairs, our housing, and our human services bureaucracies. Each of these agencies in our state has had to learn the other's language, which, as all of you know, is not a process that occurs naturally within government. Using existing tools creatively and with unprecedented collaboration, we have improved our governmental processes and produced an innovative program that responds to significant budgetary as well as human needs.
While designing Elder Choice, I've had the privilege of meeting a number of the clients in our assisted living program. The typical resident of assisted living is 85 years old, and though independent of spirit, needs help with personal tasks like bathing, grooming, and eating. She's most likely female and has spent her life raising a family and caring for a husband through his last years. Every person in this room knows or is related to someone who meets this description. They also know the painfully limited options available to an elderly person who no longer has the ability or the resources to continue to live alone. Elder Choice provides these frail seniors with their own rental apartments and 24-hour services. Often, this combination of services and a home will forestall or prevent placement in a nursing home. Without services, many frail elders continue to live in their own private homes isolated until a major medical catastrophe necessitates hospitalization or placement in a nursing home at substantially higher public cost and personal anguish. Through a mixed-income rental structure, Elder Choice gives low-income seniors access to assisted living and promotes financial feasibility. In targeting a specific group of needy seniors, we provide a coordinated response at substantially lower cost than the alternatives. For example, the 500 apartments underway through Elder Choice represent over $2 million in projected savings in the state's Medicaid budget every year. Given national concern about Medicaid expenditures, strategies which offer real savings while providing care in a form preferred by consumers cannot be overlooked and will be increasingly important with the aging of the baby boomer generation. It is estimated that more than 60% of women over 85 who are not in nursing homes now need assistance with a basic living task. Needing help with food preparation and eating, with bathing and dressing, with going to the bathroom or knowing when to take complex medications do not seem like major health issues until you or a loved one experiences it. Through the synthesis of housing and healthcare financing strategies, Elder Choice meets this need. Thank you.
Right on time. That was perfect timing. First question from Jack. And the next one, I believe, Max.
Assisted living is a wonderful departure and needed all over the country, but that's not the innovation here. I mean, we've seen assisted living begin to develop in other places. Could you tell us a little more about what the lever that you bring to it is?
Sure. I think, in fact, Oregon has pioneered in some assisted living efforts, as have other states. The lever that the Mass Housing Finance Agency brings to it is that we worked with other state agencies to create a program using the capacity of our tax-exempt bond financing to offer a less expensive lending package, along with housing programs such as the Federal Home Program or the Community Development Block Grant Program, which had not been applied to assisted living before. With that, we worked with the Medicaid administration within our state to take some of their existing community-based reimbursement programs to consolidate a financing package which supported a mixed income model of assisted living. In Massachusetts, the development of assisted living had really been retarded because we have a very well-developed nursing home industry and a regulatory structure which protects that industry, and that had really stood as a barrier to the development of assisted living within Massachusetts. So both on the financing front and on the regulatory front, our agency was innovative, I think, in trying to figure out ways to create a mixed income model in our state.
Thank you. Max?
One of the issues that you've raised yourselves in the application and that other material we have indicates is that the cost is very high still. And in fact, one suggestion is that if that public actually saw the actual cost, there might even be some lack of public support. Could you comment on the cost? Because I think that is a major concern.
Right. The cost for assisted living, just so people know, in comparison to housing programs, just for the operating piece, which includes all of the services which an elder might need, personal care services and the like, is probably $16,000 or $17,000 a year. This is in contrast to an elderly housing development without any services, where the cost may be $5,000 a year in terms of operating costs. The $16,000 or $17,000 really needs to be compared to how much it costs to keep an elder in their own home when they need 24-hour-a-day care. And when you're looking at 24-hour-a-day care in your own home, you're talking about 3 shifts of people all year long. If you're talking about home care services, which are another way that elders are served in their own homes, home care is usually available only in 2-hour increments at specific times during the week. And so if you need help eating or preparing a meal or taking a bath, the availability of the home care may not come at the time when you need that service. And so the costs, while they are significant, are still much less expensive than nursing care, which is the usual alternative, and more appropriate for the kind of care that frail seniors need.
What does the $16,000 compare with in that case?
I'm sorry, I don't know.
If you're to compare the $16,000 with nursing care.
Oh, with nursing care, upwards of $25,000 a person.
What opposition or obstacles did you encounter from the traditional suppliers of these services in the course of developing your program?
As Allison indicated, in the nursing home industry, they were obviously very concerned about an already existing overcapacity and the threat that new assisted living developments would make to them. We had to make very clear, and out of this grew, I should say, an entirely new legislative and regulatory structure that has really enhanced both the market acceptance of assisted living, both for purely market developments. As you indicate, this is a market based industry already, and for affordable assisted living such as we have. We had to make clear to the nursing home industry that we had no medical component in assisted living. We can go up to that line with certain types of medication advice and nursing assistance, but there is no medical component in assisted living, which is fine with the people who are living there because clinically they're all pre-tested to be sure that they can live without a medical component. We also had a lot of problems from affordable housing developers who had never dealt with elderly housing and assisted living before, and they've had to learn an entirely new language, but it's working very well.
Tom, do you have one last quick question? Oh,